to. We also want to let you know that this presentation is being recorded. And we also want to just request that you guys stay muted until after the presentation is over. And there will be a Q&A session at the end where you can ask any questions that you have. At this point, I would like to introduce Juan and Claire, two MS1s who have generously contributed their time to this presentation to help us translate it in Spanish and make it as accessible to as many people as possible, especially Spanish speakers. And now I would like to offer the floor to Dr. Augenbraun, who is an amazing infectious disease expert and will be walking us through this presentation. So Dr. Augenbraun.
Thank you. Thank you. I hope everybody can hear me okay. I want to thank the conference organizers for putting this together. It's never be too much information, especially about a hot topic like this. Anyway, just by way of introduction for folks on the call, I am the director of infectious diseases at both SUNY Downstate and at Kings County Hospital. And I've been working here for over 30 years. So I'm pretty familiar with the community and the problems that besets the community. My work has been subsumed by COVID for the last couple of years. I don't pretend to have all the answers about COVID. I'm not sure anybody really does. But after 2 years, we have a pretty reasonably clear picture of what we've been coping with and the means to provide some sort of control. So I hope to, in the next, I don't know how long this talk is going to take, let's say 30 minutes or so, provide some sort of a general outline about general concepts about COVID, both it's sort of what it does, how it does it, and methods of management, let's say. And then we can open it up to questions because there's always lots of questions. And again, I don't pretend to have all the answers, but I certainly can try. So let's go ahead with the next slide.
Ok, so hola a todos, bienvenido a la presentación sobre COVID-19 y vamos a hablar sobre lo que necesitas saber sobre el virus. Y para conocer a tu presentador, es un doctor que se llama Dr. Michael Augenbraun y él es un profesor en el Colegio de Medicina, es vicepresidente del Departamento de Medicina y director de la División de Enfermedades Infecciosas. Y también quiero decir que esta presentación va a ser grabado. Y quiero decir también que este es un espacio seguro y por favor no dude en hacer cualquier pregunta o comentario porque queremos que todos aprovechen de la presentación. Gracias.
So to start, what actually is COVID-19? Well, COVID-19 is the name of the disease that we associate with the virus being SARS-CoV-2. And SARS-CoV-2 viruses are viruses that come from a family of viruses called coronaviruses. And it's important to understand that coronaviruses are actually very common in nature, that human beings have long been known to suffer with types of coronaviruses that cause seasonal cold symptoms. That's not the same thing as this coronavirus. There's something different about this, but we do have experience with coronaviruses. And in nature, many different species of animals are afflicted with their own coronaviruses that don't infect human beings. And we say that coronaviruses can be zoonotic, meaning that they can jump from animals to humans. And this is true about a lot of infections, in that we know that these viruses can jump what's called the species barrier. That is, they can infect animals traditionally, and then for one reason or another, somewhat inexplicably, probably through mutations, they develop the capacity to jump and infect human beings, because human being cells are not the same as animal cells, and viruses evolve over time to affect particular types of cells. But be that as it may, at some juncture, the animal coronaviruses infect the human beings. And that's what we think happened here with this particular type of coronavirus, that it was an animal coronavirus that for many different reasons, and we believe this happened in central China in a food market, in a food supply market, where a lot of animals, live wild animals were kept, that this virus jumped from an animal to an unsuspecting human being and then spread from one human being to the other. Now, like its relatives, COVID-19 or SARS-CoV-2, again, to be more specific, is primarily a respiratory disease. And it does its dirty work by infecting the lungs, causing pneumonia. And that's what we saw when we saw the most severe aspects of infection. But truth be told, it looks like SARS-CoV-2 can affect other parts of the body, including the gastrointestinal tract, the nervous system, the skin, so on and so forth. So it has a wide range of possible effects, and I'll leave it to my colleagues to translate all of that into Spanish.
Ok, ¿qué es el COVID-19? Es un miembro de la familia del coronavirus y es causado por el virus que se llama SARS-CoV-2. Coronavirus puede ser zoonótico, que significa que se puede saltar de animales a seres humanos, y igual a otros virus en la misma familia. El COVID-19 es principalmente una enfermedad respiratoria, la cual empieza en los pulmones y causa síntomas similares a los de neumonía, pero también puede afectar a todo el cuerpo.
Now, getting down to even grainier detail about how these viruses affect humans or infect humans, most people have seen this schematic that purports to show sort of a cartoon figure of the virus. And you can see these knobby projectiles coming off of the capsule of the virus. And those knobby projectiles are the spike proteins. And that allows the virus to attach to human cells and infect it. And the knobby proteins, or spike proteins, have become the primary means by which we try to develop, both naturally and through vaccination, antibodies to block that binding of the virus to the cells in the human respiratory tract. This is just to also mention, it mentions it on the slide, that this is an RNA virus, and the blue-green sort of squiggly line inside the ball of the virus is meant to be the genetic material that the virus carries around in order to replicate itself, because that's the only thing that viruses do, is they replicate themselves. They're an unusual class of organisms. They don't do things that a lot of other organisms do. They don't breathe, they don't eat, they don't grow, they simply replicate. And that's the material that allows them to do that, is the RNA. Go ahead.
¿Cómo el COVID-19 puede afectar a los humanos? Coronavirus tienen proteínas de espiga. La proteína espiga es la parte del virus que se adhiere a una célula humana para infectarla, lo que le permite replicarse o copiarse dentro de la célula y propagarse a otras células. Algunos anticuerpos pueden protegerlo del SARS-CoV-2 porque se pueden atacar estas proteínas de espiga.
This is a schematic, furthermore, a cartoon version that shows us sort of what it looks like when the virus actually does its thing. You can see the virus on the far left-hand side of the screen with those red knobby projectiles glomming onto these other proteins that are on the surface of the cell, which is the human cell, which is below that, and in getting incorporated subsequently by a process of engulfment into the cell, after which the virus releases its RNA, which is again that sort of blue-green aqua squiggly line. And then in the middle, that becomes incorporated into the cell, and the cell's machinery for reproducing protein material based on that code in the RNA is taken up by the cell's mechanism. So the virus is basically squirted its own instructions into the cell, and it hijacks the cell to make viral proteins instead of cellular proteins. And eventually all those pieces are put together, and on the far right-hand side of the slide, a new copy of the virus is exuded into the environment, just like the old virus was, except that it used the body's cell to do this.
¿Cómo el COVID-19 afecta a las células humanas? Para entrar en la célula, el virus se une al receptor. Una vez dentro, se libera el material genético del virus, o ARN. La célula infecta lee el ARN y empieza a producir proteínas que suprimirán el sistema inmunológico. Mientras que avanza la infección, estas nuevas proteínas forman copias del virus. Las nuevas copias del virus se ensamblan y transportan a los bordes exteriores de la célula y luego infectan otras células humanas.
So now we sort of understand a little bit about how the virus gets in and then again hijacks sort of cellular function so it replicates itself. Well, then how does it spread from person to person? Because simply infecting one individual is not going to propagate the virus, and the virus lives to replicate. So it's got to find hosts. And this virus spreads primarily through small respiratory droplets, as do most viruses that infect the respiratory tract. And depending on the sort of activity that we engage in, we may or may not produce more or fewer respiratory particles that are capable of spreading the infection. So you see that on the right-hand side of the slide, if you sneeze, you can spread potentially 40,000 droplets in a sneeze, each of which can contain one or many copies of the virus, whereas coughing is far fewer and talking is even less than that. So the capacity to spread infection is to a certain extent dependent upon what sort of activity you're involved in. And again, thinking about it, you know, most of these respiratory infections provoke sneezing and coughing on the part of the host. And that's almost like creating an environment that's conducive for the spread of the infection. And these droplets can travel far. They can travel 3 to 6 feet, and they can remain infectious for anywhere from 4 to 48 hours, depending on the surface. What's even more worrisome is if people are admitted to the hospital and undergo certain types of procedures, the droplets can be even made to be produced in an even finer size, a smaller size, that are going to be so small that they can linger in the atmosphere of the room for many, many, many hours and pose a potential for infectious risk in the hospital that is even beyond the description here. So that's one of the problems that we've been coping with in the hospital for quite a long time now. Go ahead.
¿Cómo se propaga el COVID-19? El virus se propaga principalmente a través de pequeñas gotas respiratorias. COVID-19 se propaga a través de pequeñas gotas, saliva o moco que una persona infectada expulsa cuando tose, estornuda o habla. Estas gotitas pueden viajar de 3 a 6 pies y permanecen infecciosas entre 4 y 48 horas, dependiendo de la superficie.
Who gets infected with COVID-19? Well, I think we've seen that almost anybody can get infected. Young children, mature adults, older adults. I see things in the newspaper. My dog can get this. Deer in the field or in the woods can get this. Sounds like almost anybody can get this. But the real question is, who gets the sickest? You know, if this was all a common cold type thing, it wouldn't be much of a worrisome thing. But some people get very sick. And some people get very sick for reasons that we don't understand. But the vast amount of information tells us that there are certain risk groups who are at a high risk for severe complications. And these include older adults, meaning over 65, and individuals with chronic health conditions. Not entirely surprising. They're at higher risk. These two groups are at high risk for lots of complications of medical problems. And when we talk about chronic health conditions, we talk about people with various types of respiratory conditions, cancers, heart conditions, kidney diseases. People with the groups of people we worry particularly about are people whose immune systems don't function quite well. And that may be as a consequence of medication they're on. It may be because they're transplant recipients, so on and so forth. Those HIV infected individuals who are not benefited by antiviral therapies, those are people at very high risk for going on for complications, something worse than a cold. The other group we worry about, and there's increasing amounts of information about this, is pregnant women. There seems to be a higher percentage of complications and adverse consequences for pregnant women who get infected, both for themselves and for their unborn child. And we always worry when we look at any disease state, how it potentially affects pregnant women, because the health of pregnant women is a real reflection of the health of our society. So that's another group we need to be concerned about. Diabetes is another group. People with diabetes seem to have suffered inordinately with COVID-19, and the obese. We're just beginning to learn about how obesity is basically an immunocompromising condition of one sort or the other. And they've been inordinately affected by this infection. So COVID is teaching us a lot of lessons here, I think, and there will be much more learning to come.
¿Quién puede contraer el COVID-19? Cualquiera puede enfermarse de COVID-19. Sin embargo, hay ciertas poblaciones que tienen más probabilidades de sufrir enfermedades graves. Estos son los adultos mayores, individuos con condiciones de salud crónicas como asma, enfermedad pulmonar obstructiva crónica, cáncer, condiciones cardíacas, enfermedades renales y más. Las mujeres embarazadas también tienen más probabilidades de experimentar enfermedades relacionadas con el COVID-19.
What are the signs and symptoms of COVID-19? Well, it's a wide range of symptoms, and they can span the spectrum from no symptoms at all, or mild symptoms to very severe illness. And symptoms generally can appear anywhere in a range from 2 to maybe 2 days to 2 weeks after the exposure to the virus. And although people are at high risk, it's certainly possible that some people who are not in the high risk groups can also have severe symptoms. So what are the symptoms? Well, very commonly fever and chills, very commonly cough. If the disease becomes somewhat more severe, people are afflicted with shortness of breath or difficulty breathing. And those are symptoms that are mostly attributable to the respiratory tract. On the other hand, you could just be extremely fatigued and tired. Muscles or body aches. You may suffer with headaches. Interestingly, it was early on appreciated that people seem to suffer a loss of taste or smell. And that was not something we had seen with too many other disease conditions. And it seemed fairly characteristic of this infection. People are also known to suffer with sore throats, congestion or runny nose. And as I mentioned, the GI tract, the gastrointestinal tract can be affected. And we've seen people who present primarily with nausea or vomiting and or diarrhea. So a wide range of symptoms associated with this infection. And they can run the gamut from mild to very severe.
¿Cuáles son los signos y síntomas del COVID-19? Amplia gama de síntomas reportados que van desde síntomas leves hasta enfermedades graves. Los síntomas pueden aparecer de 2 a 14 días después de la exposición al virus. Cualquiera puede tener síntomas de leves a severos. Las personas con estos síntomas pueden tener COVID-19. Estos son fiebre, tos, dificultad para respirar, fatiga, dolores musculares o corporales, dolor de cabeza, nueva pérdida de gusto o olor, dolor de garganta, congestión o secreción nasal, náuseas o vómitos y diarrea.
So what should you do if you feel sick? Well, I guess you should try to seek out some medical advice, probably. We haven't seen a lot of other respiratory infections these days since everybody's been so cautious about COVID and wearing masks, so on and so forth. So if you have symptoms consistent with COVID, certainly within the last 2 years, there's a good chance it could be COVID. I don't know if that's going to be true going forward. But one of the things we worry about is if you have symptoms consistent with COVID, that you could be infectious to other people. So you should try to stay home as much as possible, unless, of course, you need medical care. You should get tested because, again, that helps us understand whether you really have COVID or you have something else. And because we're trying to limit the spread of infection from one person to the other, you should try to separate yourself from other people. You have to monitor your symptoms, seek emergency medical attention if necessary, and that's always true. If you have any questions whatsoever, you really need to seek medical attention. If you're sick, you should wear a mask. Of course, all of us are wearing masks these days, although I understand this week they're going to relax a lot of the restrictions. And I guess the last bullet there means to say clean your hands well and often. That's probably true in all circumstances, that washing hands is critically important to stop the spread of infections. And there are a list of websites on the right-hand side of the slide that you can access that have good, easy to understand instructions about various types of issues around COVID and resources that you can avail yourself of if you think you have COVID.
¿Qué debe hacer cuando se siente enfermo? Trate de quedarse en casa tanto como sea posible, a excepción de de buscar atención médica. Hágase una prueba de PCR o alguna prueba de COVID-19. Sepárese de otras personas para controlar la expansión del virus. Controle sus síntomas, busque atención médica de emergencia si es necesario. Y si estás enfermo, usa una mascarilla si tienes que salir. Limpia sus manos bien y con frecuencia. Y en el lado derecho pueden ver algunos recursos en la ciudad de Nueva York en la que pueden encontrar más información sobre el virus.
We're going to talk a little bit about the types of tests that are available right now. There's a lot of confusion around this. There are two basic types of tests. One is a test that specifically tries to identify the virus itself in the individual. And those have mostly been conducted through the use of nasopharyngeal swabs, where the swab goes into the nose, into the back of the nose, very unpleasant looking experience. There are also potentially saliva tests, so those seem to work less well than the nasopharyngeal swabs. And of these virus-specific tests, there are really two sorts. One is a nucleic acid amplification test that you see sort of highlighted in the middle of the slide. And the other one is an antigen test. And without going into great details, suffice it to say that the nucleic acid amplification tests are very sensitive. They'll almost always pick up infection, even if it's, at any degree, almost to the point of where they'll still be positive if patients have gotten over their infection and are no longer infectious. Antigen tests, on the other hand, are somewhat less sensitive. They're oftentimes used in clinic settings because they can be done rapidly at the point of care of an individual. You don't need special equipment. But again, they lack a little bit of sensitivity, and so people with real disease can be missed if these tests come up negative. So you have to be a little bit careful about over-interpreting antigen tests. The other class of tests that get a lot of press are the antibody tests, highlighted in the far right-hand side of the slide. And these are blood tests, and these are not tests per se of the virus itself, but rather of the body's immune response to the virus, the production of antibodies. And antibodies simply tell us that an individual has been exposed to the virus, but it doesn't tell us, number one, when that happened. And number two, it also doesn't really accurately tell us right now whether an individual is truly immune or not. We don't know if the antibodies can determine that. Most commercial tests cannot tell us that. So the best you can do with an antibody test is that it helps you know whether you've ever been infected with coronavirus, or alternately, if you've ever been, some of the tests, if you've ever been vaccinated against the virus. So the antibody tests are not really useful for clinical care, I would have to say. They have probably some utility for epidemiologic studies, but not for clinical care.
¿Qué exámenes de COVID-19 hay disponibles? Hay dos tipos diferentes de exámenes que tienen disponibles. En el lado derecho pueden ver algunos de los exámenes. Las pruebas de SARS-CoV-2 demuestran si usted tiene una infección en el momento en el que se hace la prueba específicamente. Y este tipo de prueba se llama prueba viral porque busca una infección viral. El otro tipo son pruebas de anticuerpos que pueden indicarle si tiene una infección pasada con el virus que causa COVID-19. Su cuerpo crea anticuerpos después de infectarse con el SARS-CoV-2 o después de vacunarse contra el COVID-19. Estas pruebas se denominan pruebas de anticuerpos o serologías.
One of the topics that gets a lot of attention these days are this question of variants of COVID-19. And really, again, just to be specific about this, it's really variants of the virus, which is SARS-CoV-2. The disease state is COVID-19. And, you know, viruses, like a lot of microbes, constantly replicate, as I mentioned early on. And in the process of replicating, these microbes make mistakes. And the process of replication leads to mutations. And the mutations result in the development of these variants, which is to say that they are subtly different from one another. And we could go on and talk endlessly about it. The pressure of antivirals or antibiotics or other immune mechanisms can sometimes force types of variants to appear. But having said that, one thing that's been clear over the last 2 years is that with the development of variants, sometimes comes changes in the complexion of the pandemic. We end up with variants that are more severe in the manner of disease they cause, or they may be more severe in their capacity for being transmitted from one individual to the other. You know, in the fall of 2021, the case rates of COVID had declined rather nicely, and we were sitting, I think, pretty at the time. I didn't anticipate the development of what's been called this Omicron variant, which caused an enormous amount of disruption by being highly transmissible amongst people. There's been some feeling that it causes less severe disease. That's not entirely clear, but it certainly infected many, many, many people, including people who had been vaccinated and should have been protected against infection. They were luckily, I think, protected against severe disease, but many people got infected. So, you know, the appearance of these variants is not surprising. We know this about microbial replication, that mistakes in replication happen, mutations arise, and mutations lead to variants, and sometimes variants have different characteristics than the original strain of virus. And I think one of our main concerns right now is whether we've seen the last of these significant variants, or whether we can anticipate that new variants will pop up again. I don't know. I don't have a crystal ball on this. I'm hoping that the latter is not true and that we're done with this, but we will see.
¿Cuáles son los variantes del COVID-19? Primero que todo, variantes se crean porque los virus están constantemente dividiéndose y al dividir se crean errores que pueden salir creando mutaciones en el virus, lo que crea los variantes. El virus que causa COVID-19 cambia constantemente y se espera que ocurran nuevos variantes del virus. A veces nuevos variantes surgen y desaparecen. Otras veces nuevos variantes persisten. Numerosos variantes del virus que causa COVID-19 están siendo rastreados en los Estados Unidos y en todo el mundo durante esta pandemia. Algunos variantes de COVID-19 de las que puede haber oído hablar serían variante Omicron y variante Delta.
How do you protect yourself? The $64,000 question. How do we protect ourselves from COVID-19? So there are many different means of doing this. And what's listed here are some of the guidelines recommended by the CDC. Wearing a mask in public when you're in groups of people. I think one of the confusing issues about the masks is that not all masks are equal. Surgical masks probably offer some less protection, especially in the setting of Omicron, which spread much more aggressively than some of the previous strains. But surgical masks by themselves probably offer some, but not maximal protection. Double masking is supposed to be somewhat better. And then using high particulate respirators that we've heard about, such as N95s or KN95s, which are difficult to wear for extended periods of time for most people. Those are really high level respirators we use in a hospital environment. Those probably offer the maximal benefit. And the masks work both ways. They both protect us from inhaling viral particles, but they also restrict us from exuding or exhaling viral particles. So they're important measures. Critically important is getting vaccinated. This is a point of great contention, I think, for some people, but not for most of us in the scientific and medical community. We have now over a year's worth of experience with these vaccines. And I will tell you that the vaccines are safe and that they are highly effective in preventing, in some instances, infection, but more importantly, in preventing severe disease and death. There's no doubt in my mind about that. The people that we see right now who are generally hospitalized or dying with COVID in the hospital are almost uniformly people who haven't been vaccinated, them or other people who have low likelihood of responding to the vaccine. So the vaccines are really, really important. And that's not to say that vaccines don't have potential side effects. There's no medical intervention that doesn't have a side effect. There's no anything that we do that doesn't have a particular downside. But what all of us have to engage in is a risk-benefit analysis. What is the potential benefit of the action versus the potential risk? And I think even though there are side effects associated with the vaccines, these are infinitesimal compared to the benefit that you can glean from the vaccine. We recommend that people, engage in proper hygiene practices. Wash your hands frequently so you don't pick up viral particles and contaminate yourself. Disinfect and clean surfaces. Follow quarantine guideline. If somebody in their household or you are sick, you have to separate yourself from other people. It's common sense stuff. And maintain social distancing. And again, as this becomes less common in our community, maybe we'll be able to do less of this. Now, I do want to depart a little bit from this slide because I'm not sure that this is included in the slides, but there are medical interventions for individuals who are infected with COVID, and you have to reach out to medical practitioners in order to avail yourself of these things. They include medication and infusion of both oral medications and infusions of some intravenous medication that can, if given early enough in the course of a COVID infection, can abort the COVID infection quite effectively. But again, you have to get it rather early. And we do recommend most of these interventions for those individuals at the highest risk of complications from COVID. Not for everybody, but for people at the highest risk of COVID complications. So if you think you have COVID or if you have COVID, and if you think you're in a high risk group, you should talk to a medical professional about availing yourself of one of these interventions, either the medications or the intravenous therapies. I think go on to the next slide.
So, ¿cómo puedo protegerme del COVID-19? Las siguientes son algunas de las pautas recomendadas por el Centro de Control de Enfermedades. Usar una máscara en público. Usar la máscara te va a proteger a ti de sostener algunas gotas contagiosas y también van a proteger las personas alrededor de ti de que se contagien en caso de que tú estés contagiado. Vacunarse para prevenir la contagiación o prevenir síntomas peores. Lavarse las manos con frecuencia, desinfectar y limpiar superficies. Sigue las pautas de la cuarentena y mantener el distanciamiento social.
Which COVID vaccines are available? We alluded to them before. I will say right now, the ones that are available for the most part are the two on the left-hand side of the slide, the middle and the left-hand side of the slide, the Pfizer and the Moderna vaccines. These are mRNA vaccines. The Johnson & Johnson is not, I think, uniformly available anymore. The Pfizer vaccine can be recommended for children as young as 5, whereas the Moderna vaccine, I don't believe has approval for younger than 18. Both of them are 2 doses. And when we originally started giving these out, we were giving them out apart about both doses about 3 weeks to 4 weeks apart. There's some data now suggesting that spreading the doses out even further might be quite effective and more helpful. And right now, there are recommendations for booster doses. And booster doses are an extra dose above and beyond the primary series of 2 doses. And the reason that was being recommended was because it was clear that the antibodies that developed as a response to the original primary series of vaccine waned with time, and that people were probably at a higher risk once this happened for yet again acquiring COVID. And so that another dose of vaccine would basically boost the levels of antibodies and afford additional protection. And originally, this recommendation was made, again, for people at the highest risk of exposure, subsequently recommended for a wider range of the population. I think it's basically open to most everybody right now. And whether or not we're going to have additional vaccines for people or have recommendations is not something that's known to me, I think, anybody right now. And we consider ourselves fully vaccinated at least 2 weeks after the second dose. You don't develop immunity right after a vaccination. It takes a couple of weeks for your body's immune system to develop full immunity.
¿Cuáles son las vacunas disponibles contra el COVID-19? So, ahora las vacunas que se están utilizando son Pfizer y Moderna. Las vacunas Johnson Johnson no creemos que están siendo utilizadas ahora. Las edades recomendadas para Pfizer son 5 años y arriba, pero para Moderna son de 18 años para arriba. Las primeras series de la vacuna son 2 dosis para las 2 Moderna y Pfizer y se dan entre 3 a 4 semanas aparte, y se tiene que dar una vacuna de refuerzo después de algunos meses, porque después de que el tiempo pase, vas a perder parte de la inmunidad que te da la vacuna. So, después de algunos meses es recomendado que se dé una vacuna de refuerzo. Y tú estás completamente protegido con la vacuna después de 2 semanas de la segunda dosis. Y eso es porque tienes que dejar que tu cuerpo crea su propia inmunidad, y eso se toma un poquito de semanas.
How do vaccines work? Well, basically vaccines mimic infection by exposing the body to particles of the original infectious organism, but preferably not a living organism. And the body responds by making an immune response. There are different ways that these vaccines stimulate the immune system. I mentioned antibody production before. That's one way. The immune response of the body is much more complicated. It's simply the production of antibodies. There are other cells that are brought in to orchestrate the full complement of responses. We just have a harder way of measuring these. So suffice it to say that there's more than one way that the body deals with this and more than one way that the vaccines stimulate immunity. As I said before, it typically takes a few weeks after vaccination for the body to produce immune cells. So we have seen people who get vaccinated and the next day or the day after get infected, and then they say to us, see, the vaccine didn't work, which isn't entirely true because, you know, it takes some weeks to build up full immunity. And sometimes, you know, the vaccines, again, since the vaccines work by mimicking the immune response to an infection, the vaccines themselves cause symptoms that are consistent with a milder case of a viral infection. So people may get achiness, fatigue, fever, so on and so forth. But these are usually self-limited and short in duration and mild and pass within 24 to 48 hours. And I think that's been our experience with these vaccines as well.
¿Cómo funcionan las vacunas? Las vacunas contra el COVID-19 ayudan a nuestros cuerpos a desarrollar inmunidad al virus que causa COVID-19, sin que tengamos que controlar la enfermedad. Diferentes tipos de vacunas funcionan de diferentes maneras para ofrecer similar protección. Pero con todos los tipos de vacunas, el cuerpo se queda con un suministro de células inmunes de memoria, que recordarán cómo combatir este virus en el futuro. Por lo general, toma unas pocas semanas después de la vacunación para que el cuerpo produzca las células inmunes y por lo tanto es posible que una persona pueda infectarse con el virus que causa COVID-19 justo antes o justo después de vacunación y luego de enfermarse porque la vacuna no tuvo tiempo suficiente para brindarte protección. A veces, después de la vacunación, el proceso de construcción de inmunidad puede causar síntomas como fiebre. Estos síntomas son normales y no son signos de que el cuerpo está desarrollando, inmunidad.
We mentioned boosters already. Boosters are just a mechanism of using the vaccine to boost or enhance the original response to the vaccine, which we think wanes after some period of time. And so there are recommendations at least 5 months after completing the primary series of either the Moderna or the Pfizer that you get a booster dose. This is not necessarily recommended for the youngest of the vaccine recipients for whom there's not a lot of data on that. The other thing just to mention, and I didn't mention this before, the Janssen vaccine, which is really not being used in the United States anymore for primary vaccine series, had offered the convenience of a single dose as opposed to Moderna and Pfizer, which was a 2-dose vaccine. It's currently recommended that anybody who got the Janssen or J&J vaccine at any time in the last year receive a single additional dose of either the Pfizer or the Moderna, and that this seems to prime the immune system again. And you could call that a booster, I suppose, or completing the series. I think it's a little bit unclear on what the definitions are, but that's the recommendation.
¿Qué es un refuerzo y deberías obtener uno? Una vacuna de refuerzo contra el COVID es una dosis adicional de una vacuna administrada después de la protección proporcionada por las inyecciones originales que haya comenzado a disminuir con el tiempo. El refuerzo ayuda a las personas a mantener una fuerte protección contra la enfermedad grave contra el coronavirus. Pfizer y Moderna, las dos hay vacunas de refuerzo para proveer después de meses de protección, pero con la vacuna Janssen, primero habían dado la facilidad de que solamente era una vacuna, pero ya no la estamos utilizando tanto acá en Estados Unidos. Son recomendados si tuviste una vacuna Janssen de tener una vacuna de refuerzo Moderna o Pfizer para completar la serie.
Is reinfection possible? Again, I think I alluded to this before, especially with the Omicron strain. It looks like reinfection is possible, that even after the natural infection, which stimulates some immunity, or receipt of the vaccine, which stimulates vaccine-inducible immunity, people have gotten reinfected with the Omicron strain. But generally speaking, these reinfections tend to be weaker, less severe. And I think we can expect that this virus may actually mutate into something that looks more like a flu-like illness from year to year or a cold-like virus, but that also remains to be seen.
¿Es posible reinfectarse? Ah, ¿Qué significa reinfección? Sería lo primero que deberíamos saber. Es una reinfección con el virus que causa COVID-19. Significa que una persona se infectó, se recuperó y luego se volvió a infectar. Después de recuperarse de COVID-19, la mayoría de las personas tendrán cierta protección contra las infecciones repetidas. Sin embargo, las reinfecciones ocurren después de COVID-19. Todavía estamos aprendiendo más sobre estas reinfecciones, pero sí es posible reinfectarse.
Now they're asking us to address common myths around COVID and COVID vaccine. So the first of these is that the ingredients in the vaccines are dangerous. And again, we've not seen this. You know, most of these things are vetted well before they're administered in the community. And by the way, there was a lot of people rejected receipt of the vaccines, particularly the mRNA vaccines, because they felt it was too new and hadn't been tested long enough. The fact of the matter is that mRNA vaccines or this technology had been around for a couple of decades now, and that it was rapidly put into production for this particular situation because we needed something desperately. We really have not seen that any of the vaccine components are dangerous to anybody. Another myth is that the natural immunity I get from being sick with COVID-19 is better than the immunity I get from COVID-19 vaccination. Again, that may or may not be true. Immunity as a consequence of viral infection is a wide-ranging phenomena. And you may have a mild case of COVID-19 and it doesn't provide you with much protection. You may have a severe case of COVID-19 and that provides you with adequate protection. I don't think anybody wants to risk getting a severe case of COVID-19 in order to obtain satisfactory immunity. The thing about the vaccines is that it's standardized. We know the dose, we know the reaction, we know what we can expect from most people in terms of their immune response. So it's a much more understandable process. So natural immunity is not better, could be worse, I guess could be better, but it's unpredictable. Another myth is that COVID vaccines cause variants. We don't have any evidence of that. Again, it is possible that the immune response somehow provokes the development of variants, but that would be true for natural immunity as well as for the vaccines. And we can't avoid trying to protect ourselves in the fear that we're going to create variants. I will say that in an era in 2020 when we didn't have any vaccines, we had the worst forms of disease in our community. So somehow the virus was able to cause severe disease without pushing variants from vaccines. So I don't think that this sort of issue has much stock.
Rompiendo mitos comunes y aprendiendo la realidad. So, uno de los mitos es que los ingredientes de las vacunas contra el COVID-19 son peligrosos. La realidad es que casi todos los ingredientes de las vacunas del COVID-19 también son ingredientes en muchos alimentos, como grasas, azúcares y sales. Y estos no son peligrosos para el cuerpo. Mito. La inmunidad natural que obtengo al estar enfermo con COVID-19 es mejor que la inmunidad que tengo de la vacunación contra el COVID-19. So, la realidad es que vacunarse contra el COVID-19 es una de las formas más seguras y confiable en la que puedas desarrollar inmunidad contra COVID-19 que enfermarse con COVID-19 y arriesgar posiblemente tu vida. Mito. Las vacunas contra el COVID-19 causan variantes. La realidad es que las vacunas contra el COVID-19 no crean ni causan variantes del virus que causa el COVID-19. En cambio, las vacunas contra el COVID-19 pueden ayudar a prevenir la aparición de nuevas variantes.
Additional issues, COVID-19 vaccine contain microchips. They don't contain microchips. I can just say that flat out. Receiving a COVID-19 vaccine can make you magnetic. I saw this on the news some months ago. There's no evidence of this whatsoever. COVID-19 vaccines can alter my DNA. The current COVID vaccines, the mRNA vaccines, do not go into the part of the cell that has anything to do with DNA. They stay outside. Can we go back one slide? Thank you. They don't go anywhere near DNA, so they don't alter DNA. And the last myth here is a COVID-19 vaccine can make me sick with COVID-19. The vaccines don't contain whole virus, so it can't give you COVID, so, which is true about lots of vaccines. They can't do that, so it's just not true.
Continuando conociendo mitos comunes y aprendiendo la realidad. Mito. Las vacunas contra el COVID-19 contienen microchips. En la realidad es que las vacunas contra el COVID no tienen ningún microchip. Las vacunas se desarrollan para luchar contra las enfermedades y no se administran para rastrear tu movimiento. Otro de los mitos es que recibir una vacuna contra el COVID-19 puede hacerte magnético. La realidad es que recibir una vacuna contra el COVID no lo hará magnético, ni siquiera en el sitio en donde la vacunación fue colocada. Otro mito es que las vacunas contra el COVID-19 pueden alterar mi ADN. La realidad es que las vacunas contra el COVID-19 no cambian ni interactúan con su ADN de ninguna manera. El último mito es que una vacuna contra el COVID-19 puede enfermarme con COVID-19. Y la realidad es que debido a que ninguna de las vacunas autorizadas contra el COVID-19 acá en los Estados Unidos contienen el virus vivo que causan el COVID-19. Como no tienen el virus vivo, no pueden enfermarlo con COVID-19, pero sí le puede dar algunos síntomas como fiebre o cansancio, y eso es algo normal que demuestra que la vacuna está funcionando y que su sistema inmune está creando su propia inmunidad contra el virus.
And there are lots of sites that you can make use of to get further information. The New York City and the New York State Health Department have lots of information, as does the CDC and the World Health Organization. And I guess that's pretty much it.
Si quieres saber más, acá hay algunas de referencias en las que puedes conseguir más información sobre COVID-19, o puedes mandarnos un correo electrónico a coe@brooklynfreeclinic.org y te responderemos a cualquiera de las preguntas que tengas.
All right, we just want to open up the floor very quickly for anybody that might have any comments, any questions, anything like that. Feel free to either put it into the chat or unmute yourself.
I'll go first. How do you feel about the mask mandate for students in school?
Yeah, that's a good question. I was hoping nobody would ask that question. I think that that spread of virus is controlled to a certain extent by the use of masks. I do think masks make a difference. I don't think they're the be all and end all. I'm not a pediatrician, by the way, so I don't lay claim to any expertise in that area. But I will say that my experience tells me that children are not as, don't practice hygienic activities as well as we might hope they would do that. And childhood remains a source of lots of different types of infections. We certainly have experience with that. So that masks probably offer some level of protection and probably are good practice. Deciding, though, when we reach a point as a society that says that the levels of disease in the society are so low that we can go without is something the public health authorities have to wrestle with on a daily basis. I think right now, I just looked at the data from the city and the state health department, and thankfully the rates in our community are very, very low. They're probably as low as they were in the fall, if not in the summer of last year, when rates were super low. And I think that those sorts of considerations in conjunction with other things might mean that masks become less important in the schools. And then other people have concerns about masks for children and whether their socialization skills are somehow inhibited by that. I can't claim expertise on that too, but that's a again, a sort of a risk-benefit analysis that people who, are in education and take care of kids have to wrestle with. So I think masks are important in kids. I think it was a good idea to probably have them mandated in the schools. Whether we need going forward to continue that practice is a decision that other people have to make. It might be something we can do away with, but I don't have that expertise. Is that a fair dance around your question?
I think you did a great job.
I have been sent a few questions from people in this presentation or people who can show up that I'll ask on their behalf. So one of the questions that I received was, how do you think the federal, state, and local agencies and public health officials internationally have handled the spread?
That's a loaded question. I would have to say that, that they have done a pretty good job. I would say that there have been missteps, but, there's been an absence of information in a lot of places. And the developments have been very quick and swift, and it's been hard to sort of keep up with a lot of things. I don't think there have been any major league problematic errors. I will say that I think, maybe I should step back, I'm a firm believer in that this has been a public health emergency of extraordinary range, and that, like a war, as a community, we have to take major league steps to protect ourselves and protect our families and our neighbors. And I'd have to say that in some parts of the country, from what I understand, and I only live in New York, that public health authorities and political leadership has not stepped up adequately, and probably some of these missteps have led to unnecessary illness and death. In New York, in New York State, and New York City, I think we've been fairly aggressive after getting knocked on the head in the spring of 2020. I mean, I don't care to ever live through anything like that again as a healthcare professional. So maybe we were more aggressive than other places. So I think it's sort of a nuanced thing. In some places, people took proper, the responses were appropriate. In other places, they were less than appropriate. I don't know what to say about that.
Thank you so much for that response. Michelle, I just want to make sure you raise your hand. Do you have another question, or?
Yeah, I do have another question. Are you aware, well, to take a step back, after the failures of 9/11 with communications between our agencies like the CIA, the FBI, etc., there was an organization that was formed to sort of keep the flow of information between those agencies. I'm curious if there's are you aware of any thoughts about doing the same? Because this won't be our last pandemic. And the mixed messaging regarding what we should do, what we shouldn't do, masks, it created quite a bit of confusion and certainly contributed to the distrust with vaccines and everything else. I'll give you a chance to respond.
Yeah, I mean, I can't comment on some of what you alluded to relating to some federal government agencies. I don't really have any knowledge of that. I will say that for better or for worse, public health information and management in the United States is a balkanized affair. I mean, every state is responsible legally for managing its own responsiveness. The CDC advises, but doesn't necessarily have legal stand in states which have their own authorities to deal with things. And you can imagine, in a chaotic situation like this, that may not be, the best response. Imagine if we were in a war and every state responded with its own military and its own artillery and its own air force. We would never be able to mount much of a response. So I'd have to say that the nature of our government and the way that things are set up is not necessarily conducive to a coordinated plan. I will say that I think we get smarter every time we go through these things. I think we're smarter after 9/11 about a lot of things, and undoubtedly we're going to be smarter coming out of this. But the problem is you always fight the last war. And so you become smarter about the last issue that confronted you, and then something comes out of left field and you find all sorts of shortcomings. So I think we're almost doomed to keep making some of those same erroneous missteps. But I think we're smarter. I think when there are certain things, it's sort of also, whether we can, when the dust settles, if we can debrief ourselves adequately as a society and make some uniform decisions about what we want to put in place to contend with the potential for the next pandemic. As well as I do that right now, there's a lot of division and divisiveness in the country, and that's not conducive to coming up with a uniform plan. And so maybe that's an area that leads you to really question what the future will bring. But that's a political issue.
Thank you so much. So due to the interest of time, the next question I ask will be the last question. And this is something that a lot of people have been asking about. So do you think that getting the COVID-19 vaccine caused any fertility issues?
Yeah, I know this issue came up quite early on after the administration of the vaccines, and there was some reason to think, based on some very slight evidence, that the receptors associated with the vaccine blocked had something to do with pregnancy and conception. And the data seems to not bear this out at all. The only thing I've seen recently, and again, we've been accruing data. It's now been a year, so we've been accruing a lot of data. There have been some recent data that suggest that there may be a small signal about menstrual cycles related to vaccine receipt, but again, no long-term health effects. It's hard to know what that's from, and if it's of any consequence whatsoever. I will say that from my personal experience, I'm astounded by maybe not surprised, but still astounded by the number of pregnant women I see coming into the two hospitals I work in who have not been vaccinated. And I'm bothered by that. And I wish there was a way that we could overcome the trepidation of these women against the vaccine and to avail themselves of the vaccination, because it does look in general like it's quite safe. And again, COVID is a bad thing. It's a bad thing if you're pregnant. So.
Alrighty, so I think we're going to wrap it up. We just want to thank everybody for joining. We want to thank our presenter, Dr. Augenbraun, our Spanish translators, Claire and Juan. Thank you everyone for your time. If you guys have any questions or you want to reach out with comments or anything like that, feel free to send us an email. coe@brooklynfreeclinic.org. Alrighty, guys, that's all for today. Thank you.
Thank you. Have a good one.
Thank you.